Hi, I'm Dr. Scott Haydon with Austin Plastic Surgery Institute. I want to talk a little bit today about the internal bra. A lot of people are coming in asking about it. It's something that I use on almost every breast case. This is kind of what it looks like. The internal bra is basically something that's made of the same material as our dissolvable sutures. And the nice thing about it is that it provides support either to the implant itself or the breast or both, and keeps everything in position. And so we basically have two types of different mesh. One product uses something that's called PDO, the other one is P4HB, but they both dissolve, so they're not permanent. The nice thing, particularly about the P4HB, you hear people talk about, for example, Galaflex, the P4HB, which is what I use, is that once the material has been absorbed over about an 18 to 24 month period, the collagen is still there, so the strength is left behind. And that's a big deal and a big differentiating factor with that and some of the other meshes. This is kind of a nice picture because what it's showing here is that I can either put the mesh here at the bottom of the implant in front of the muscle to support it. So it acts kind of almost like a sling. And then the other way is if I'm going back behind the muscle, I can again put it here so that it's again supporting the implant. And in some cases, I'm putting it under the breast gland itself, perhaps if I'm not using an implant, again, just to support the breast. So who do I use the mesh on? Well, we talked originally about people that just had inadequate tissue support. So what does that mean? That means people that have very lax skin. Perhaps they lost a significant amount of weight. Perhaps after pregnancy, things had changed. Maybe they had had previous surgery. Another issue that we're running across now is the new Motiva implant. The Motiva implant is phenomenal because it has the lowest capsular contracture, lowest rupture rate we've ever had. It doesn't have the same sort of foreign body response when the body sees it, but it doesn't form a thick capsule. And so I've gotten to the point now where I'm using the mesh primarily because I want to make sure that that implant sits in a good position and doesn't try to move or bottom out or go too far lateral. So again, you can see here we talk about pocket support, and pocket support basically means the pocket where the implant sits. So this is an example of bottoming out, and you can see that the implant has pushed down below the level of where the inframammary fold or where the crease used to be. And so if you imagine this, if it had been in there, it would not have allowed that to happen. So again, I've gone to the point where I'm exclusively using this product and this mesh because I've used some of the other mesh products and they do stretch and they do not maintain their strength. So this is a picture of the box, but basically I've gone to using a 19 centimeter and I use it primarily now. And I say primarily because I see a lot of patients that have had multiple surgeries in the past. Perhaps I've done some of them or someone else has done them. And the reason that people come back for revisions oftentimes is because the tissue just did not have adequate support. Perhaps there was an implant that was placed that was too big. Perhaps just the native genetics of that person couldn't keep everything in place. And so now I pretty much am using it primarily instead of before when we were using kind of just as a lifeboat. So what we found is that by doing it primarily, everything stays in good position. So that's all about the internal bra. So if this sounds like something that would be interesting to you, give us a call and we will get you fixed up as well.